Medical nanotechnology, revolutionizing healthcare. Medical nanotechnology is a rapidly evolving field that combines the principles of nanotechnology with medicine to develop innovative solutions for diagnosing, treating, and preventing diseases. At its core, nanotechnology focuses on manipulating matter at the nanoscale, which is 1/1,000,000th of a meter. By harnessing the unique properties exhibited by materials at this scale, medical nanotechnology offers unprecedented opportunities to revolutionize healthcare. The integration of nanotechnology in medicine has enabled the development of advanced drug delivery systems, targeted therapies, nanosensors for disease detection, immune modulation techniques, regenerative medicine approaches, and much more. In this script, we will delve into the intricacies of several key areas in medical nanotechnology, exploring their potential applications and impact on patient care. One of the most promising applications of medical nanotechnology is in nanoscale drug delivery. Traditional drug delivery systems often fall short in terms of efficiency, stability, and specificity. Nanoscale drug delivery systems address these limitations by encapsulating therapeutic agents within nanoparticles or nanostructured systems. These nano-sized drug carriers offer several advantages. Firstly, their small size allows for enhanced cellular uptake and tissue penetration, improving drug delivery to targeted sites. Additionally, the surface properties of nanoparticles can be modified to achieve controlled release, prolonging drug availability and reducing side effects. Moreover, nanoscale drug carriers can bypass biological barriers, such as the blood-brain barrier, enabling the delivery of therapeutics to previously inaccessible areas. Examples of nanoscale drug delivery systems include liposomes, polymeric nanoparticles, dendrimers, and carbon-based nanomaterials. These platforms can encapsulate various types of drugs, including small molecules, proteins, nucleic acids, and gene editing tools, offering personalized and precise treatment options for a wide range of diseases. Targeted therapy is a cornerstone of personalized medicine. Medical nanotechnology offers novel strategies for precise drug targeting, enabling the delivery of therapeutics directly to diseased cells or tissues while sparing healthy ones. This approach enhances treatment efficacy and minimizes unwanted side effects. Nanoparticles can be functionalized with ligands or antibodies that recognize specific biomarkers overexpressed on the surface of diseased cells. By exploiting these specific interactions, nanocarriers can selectively accumulate at the desired site, increasing drug concentration locally. Additionally, stimuli-responsive nanosystems can be designed to release drugs in response to disease-associated cues, further improving targeting accuracy. Targeted therapy has shown significant promise in cancer treatment. Nanoparticle-based nanomedicine can specifically deliver anti-cancer agents to tumor tissues, enhancing drug accumulation and minimizing damage to healthy cells. Moreover, targeted nanoparticles can overcome multi-drug resistance mechanisms by delivering therapeutic payloads directly to drug-resistant cancer cells. Autoimmune diseases, characterized by an abnormal immune response against the body's own tissues, can pose significant challenges for diagnosis and monitoring. Nanosensors, equipped with nanomaterial-based detection platforms, provide indispensable tools for accurate and sensitive detection of autoimmune biomarkers. Nanosensors can detect disease-specific molecules, such as autoantibodies or cytokines, in bodily fluids, offering early diagnosis and monitoring of autoimmune diseases. These nanoscale devices exhibit high sensitivity, specificity, and rapid response times. Moreover, their small size enables point-of-care testing, empowering patients and improving disease management. For example, graphene-based nanosensors have been developed to detect autoantibodies associated with systemic lupus erythematosus. These nanosensors offer superior sensitivity compared to traditional diagnostic methods, allowing for early detection and improved patient outcomes. Similarly, gold nanoparticle-based nanosensors have shown promise in detecting autoantigens and rheumatoid arthritis, enabling early intervention and personalized treatment. The immune system plays a vital role in combating infections, cancer, and autoimmune diseases. Nanomedicine offers innovative approaches to modulate the immune response for therapeutic purposes. Nanoparticles can be engineered to interact with immune cells, influencing their behavior, enhancing immune activation, or suppressing excessive immune reactions. One application of immune modulation with nanomedicine is in cancer immunotherapy. Nanoparticles can deliver immunomodulatory agents, such as immune checkpoint inhibitors or adjuvants, directly to immune cells, boosting anti-tumor immune responses. Moreover, nanoscale vaccine formulations can enhance antigen presentation and immune memory, improving vaccine efficacy against infectious diseases and cancers. Another area of interest is the regulation of immune tolerance in autoimmune diseases. Nanoparticles can deliver immunosuppressive agents specifically to immune cells involved in the autoimmune response, reducing inflammation and preventing tissue damage. This targeted approach minimizes systemic side effects associated with conventional immunosuppressive therapies. In summary, nanomaterial-based regeneration strategies offer exciting prospects for the treatment of autoimmune diseases. By utilizing nanomaterials like hydrogels, scaffolds, and nanofibers, researchers can create biomimetic environments that facilitate cell adhesion, growth, and differentiation. For example, electrospun nanofibrous scaffolds can guide nerve regeneration by mimicking native tissue structures and delivering neurotrophic factors. Similarly, nanomaterial-based bone scaffolds promote bone regeneration through enhanced cell adhesion and proliferation, along with the targeted delivery of osteogenic factors. These advancements in nanomedicine hold great promise for improving the outcomes for patients with autoimmune diseases. In the 6th section of the video on nanomedicine for autoimmune diseases, we discuss the important topic of nanotoxicity and biocompatibility studies. The safety of medical nanotechnology is crucial, as nanomaterials may behave differently than larger particles. Nanotoxicity studies evaluate the harmful effects of nanomaterials on biological systems, considering parameters like cellular uptake and genotoxicity. Biocompatibility studies assess how nanomaterials interact with living organisms, including factors like immunogenicity and inflammatory responses. Combining different nanomaterials can affect their toxicity and biocompatibility, necessitating comprehensive studies for the development of safe and effective nanomedicines. Personalized medicine aims to deliver tailored treatments based on individual patient characteristics. Nanobiosensors, employing nanotechnology-based detection platforms, are revolutionizing diagnostics and patient monitoring, enabling personalized medical interventions. These miniaturized biosensors can detect specific biomarkers associated with diseases, monitoring disease progression, and treatment effectiveness. By providing real-time data, nanobiosensors empower patients and healthcare providers to make informed decisions and adjust treatment plans accordingly. Nanobiosensors can be integrated into wearable devices or implanted for continuous monitoring of vital signs, glucose levels, hormone concentrations, or drug levels. These sensors offer non-invasive or minimally invasive options, reducing patient discomfort and improving adherence to treatment regimens. For instance, nanobiosensors have been developed to monitor glucose levels in patients with diabetes. These sensors can be implanted under the skin, continuously measuring glucose concentrations and transmitting the data wirelessly to mobile devices. This real-time monitoring allows for precise insulin administration, enhancing glucose control and reducing the risk of complications. Gene therapy holds transformative potential for treating genetic disorders by introducing therapeutic genes into the patient's cells. Nanocarriers, such as liposomes or viral vectors, can effectively deliver therapeutic genes to target cells, overcoming biological barriers and protecting the genetic material from degradation. These nanocarriers can encapsulate therapeutic genes and selectively deliver them to specific tissues or cell types. By tailoring the properties of nanocarriers, such as surface charge or functionalization, gene therapy can be targeted to specific cell populations, ensuring maximum therapeutic efficacy. Several approaches have been developed using nanocarriers for gene therapy applications. For example, in the treatment of hereditary genetic diseases, nanocarriers can deliver correct copies of defective genes, replacing or supplementing dysfunctional ones. Similarly, in cancer gene therapy, nanocarriers can deliver genes encoding anti-cancer agents, enhancing tumor suppression. Vaccination has been vital in preventing infectious diseases for centuries. Nanoparticle-based vaccines represent a significant advancement in vaccine development, offering improved immune responses and targeted delivery of antigens. Nanoparticles can serve as carriers for antigens and adjuvants, enhancing their uptake by antigen-presenting cells and promoting immune activation. Moreover, nanoparticles can be engineered to mimic pathogens, stimulating robust immune responses without causing disease. One example of nanoparticle-based vaccines is the use of virus-like particles, VLPs. VLPs resemble viruses' structure but lack the genetic material required for replication, ensuring their safety. VLP vaccines against human papillomavirus, HPV, hepatitis B virus, HBV, and influenza have demonstrated high efficacy and long-lasting protection. Furthermore, nanocarriers can be used to deliver nucleic acid-based vaccines, such as RNA or DNA vaccines. These vaccines can induce specific immune responses against infectious diseases or even cancers, providing an alternative approach to traditional vaccine formulations. Gene editing technologies, such as CRISPR-Cas9, have revolutionized the field of molecular biology and hold immense potential for treating genetic disorders. Nanosystems can serve as efficient and targeted delivery platforms for gene editing tools, facilitating precise genome modifications. Nanoparticles can encapsulate gene editing molecules, protecting them from degradation and delivering them to specific cells or tissues. These nanosystems can enhance the efficiency and specificity of gene editing, minimizing off-target effects. For example, lipid-based nanoparticles have been used to deliver CRISPR-Cas9 components to target cells in vivo. These nanoparticles effectively edited disease-associated genes, providing a potential treatment for genetic disorders. Nanosystems can also help overcome challenges associated with delivering large gene editing complexes or reaching specific tissues. By modifying nanoparticle properties, such as size, surface charge, or targeting ligands, the delivery efficiency and specificity can be further improved. Theranostics, a combination of therapeutics and diagnostics, holds great promise for personalized medicine. Nanomedicine plays a pivotal role in developing theranostic platforms that enable simultaneous diagnosis and treatment, improving patient outcomes. Theranostic nanomedicines can carry both therapeutic agents and imaging probes. These nanosystems can diagnose diseases by detecting specific biomarkers and monitor treatment responses in real time. Furthermore, targeted theranostic nanoparticles can deliver therapeutic agents precisely to the disease site, maximizing treatment efficacy. For instance, multifunctional iron oxide nanoparticles have been utilized as theranostic agents for cancer treatment. These nanoparticles can act as imaging contrast agents in magnetic resonance imaging, MRI, allowing for accurate tumor localization. Simultaneously, they can deliver chemotherapeutic agents or heat, facilitating tumor ablation. The development of theranostic nanomedicines relies on the integration of multiple components, such as therapeutic agents, imaging probes, targeting ligands, and stimuli-responsive systems. The synergistic effect of these components enables personalized medicine approaches, facilitating early disease detection and tailored therapeutic interventions. In order to fully harness the potential of nanoparticles in treating autoimmune diseases, it is essential to understand how they interact with living cells. These interactions can vary depending on the properties of the nanoparticles, such as their size, shape, surface charge, and chemistry. For example, positively charged nanoparticles can be taken up by cells more efficiently through endocytosis, while negatively charged nanoparticles may have limited uptake due to electrostatic repulsion. Once inside the cells, nanoparticles can interact with various intracellular compartments, influencing their fate, cargo release, and potential toxicity. This knowledge is crucial for developing effective and safe nanomedicine platforms. In conclusion, medical nanotechnology offers promising opportunities to transform healthcare. Its applications in drug delivery, immune modulation, regenerative medicine, and personalized treatment hold great potential for diagnosing, treating, and preventing diseases. However, we must carefully investigate safety concerns such as nanotoxicity and biocompatibility to ensure the development of safe and effective nanomedicines. As medical students, understanding the complexities of medical nanotechnology is crucial in keeping up with advancements in healthcare. By embracing this field, we can contribute to improving patient care, saving lives, and shaping the future of medicine.